Hey guys, so as promised today, we're going to do a deep dive right now into core strength. And what I really want to focus on today is an easy way for you to assess one of the key components for core strength. So before we dive into that, I just want to do a quick review. And if you want more information or you're interested more about how the core works, you can check out the full article on the Health Means Wealth blog. I posted a brand new deep dive into the core on the website. There's lots of good information in there if you're interested. So before we dive into the core assessment strategy, I just want to talk a little bit about what our core actually is. So a lot of us think about our abdominal muscles right here, and more specifically, a lot of us think about our six-pack abs that we all want. When in reality, the muscle groups that run this way are just one little part of the picture. We also have muscles that run diagonally this way, and we also have muscles that wrap around this way in the abdominal area. Outside of the abs, we also have a lot of other muscle groups that we would consider as part of the core, like our glutes, and even the muscles up into our upper back, depending on whose opinion it is, also is part of the core. Outside of those big muscle groups, two big areas that we don't commonly think about as part of the core is the diaphragm, the muscle that actually helps us breathe, and our pelvic floor, so all the muscles in our pelvis that help us with urinary continence and a lot of other health-related issues. When I was treating patients in the clinic, a common issue with people with low back pain, or a lot of women that have issues with urinary incontinence, or really any kind of issue with low energy, a lot of it stemmed from poor core strength, or more importantly, poor core coordination. Because you can have strong muscles in certain positions, but then not have the coordination to use them with your regular daily movements, which is where it's really most important. And that's what can get us in trouble and cause back pain, injuries, and just feeling like you're off and like your energy is low, because you're wasting energy using your body when you don't have a strong, solid core to work from. So one of the big assessment tools that I used in the clinic as a physical therapist was the lower abdominal strength assessment, and that's what we're going to run through today. You can do it on your own, and I'm going to use my husband Hansa as my assistant, so I'm going to go grab him here in a second, and then we're going to run through the whole thing. The best thing is there's 5 levels for the core strength assessment, and whichever level you land at is where you can start with your core exercises. Yes. So we are going to bring our assistants in, and we're going to run through the whole assessment tool that you can use for home. Are you going to help me? Yeah. Yeah. Okay. So before we can even start level 1, the most important thing is being able to find those muscles. And this, with anyone with back pain, this might actually be the first and only step that you get through on this assessment, because it can be hard just to find those muscle groups. So when the lower abdominals are tight, the muscles should feel tight. If you poke around right inside of your hip bones, you should feel those muscles kind of flicker and tighten into your hands. And some good cues for thinking about using those muscles is tightening your abs as if someone was going to punch you in the stomach. In yoga, they tell you to bring your stomach towards your spine. Or you can also feel those muscles if you exhale. Take a deep breath and then exhale quickly. You should feel those muscles as well. So those are all ways to find those muscles. When those muscles are tight, go ahead and tighten them. You should be able to keep breathing comfortably. You shouldn't be turning red in the face. And another big sign that you're not doing it correctly is if you're getting any cramps in your lats or your neck or anywhere like that. So if you're struggling with this is a really good place to start, where you're just finding those muscles, trying to tighten them and hold them while breathing, and then relaxing. And then you can work into the actual levels of the assessment from there. Another important aspect to keep in mind when your abs are tight is being able to hold your spine and pelvis in what's called a neutral spine. So it's a little different for everyone, but it's basically the middle ground in your back where it feels strongest and most comfortable. So what I usually have people do is kind of wiggle their pelvis back and forth kind of finding where their end range of fully arched and flat are, and then settling into that middle ground where it feels most comfortable. And typically that means there's still a little bit of an arch under there, so I can get my fingers in a little bit, but not more than that. So the mistake that a lot of people make is thinking that their back has to be perfectly flat on the ground, and that's not true, as long as it feels comfortable and you can hold that position once your abs are tight. So we're going to dive into level 1 here, and what I'm going to be monitoring as he does this is that he can keep his pelvis exactly where it is. That means no arching, that means no moving side to side. And if he can do it correctly for 5 repetitions, then we move on to the next level. So here's what we're going to do. I'm going to have my hand here, and I want you to tighten your abs. And then you're going to lift one knee up towards the level of your hip. Okay, leave it there, and then bring your opposite one up. Perfect. And then bring it back down. And his abs are tight the whole time he's doing this. Come back down. And then we're going to switch to the other side. You are blocking the camera, love. And then so another thing that we're watching for as we do this is that these muscles here aren't pooching up in like a ridge type formation. A little bit of it is okay, but really make sure that you're keeping these muscles tight. So again, you can put your hands here to monitor if your pelvis is moving and that your abs are tight. And then just kind of look down every once in a while and make sure that those muscle groups going this way aren't bulging. We call it the abdominal pooch there. So we're going to assume that he's going to get to 5 repetitions because he's doing well with this. He's not rolling. His back is staying nice and supported. So we're going to go to level 2. So with level 2 and all the levels after this, his starting position is going to be with both of the knees up at hip level. And then we're going to go from here. So first he's going to bring one heel down towards the ground until it touches. And then he's going to slide the heel away from him as far as he can go while keeping the heel on the ground. And then bring it all the way back to the starting position. And then he's going to switch and do the other side. So again, we're watching here. He's wobbling a little bit, but he's doing a really good job of controlling it. So I can see that he's coordinating to keep that all in check. So let's do one more on each leg. And he's breathing, not turning too red in the face. That's what we're looking for right there. Not much pooching going on, so doing good. We're going to move to level 3. Ready for level 3?
Yeah.
So for level 3, we're going to do the same movement again with both knees up at hip level again. This time as he pushes his heel away, he's never going to touch the ground. So this is going to get quite a bit harder than the other version. So a side note on this level 3, the first time that I did it in physical therapy school, I completely failed at it and was an uncoordinated mess. So it's taken a while to progress from there. And if you get to any of these levels and you're like, whoa, why is this so much harder than I thought it would be? It's normal because you're kind of bringing a new level of awareness to your core strength, and it will get better as you learn to build that into your core workout. So now we're going to move to level 4, and we'll see how he does. So again, we're going to have our knees up at hip level, and we're doing the same move as level 2, except now we're doing it with both legs. So both heels are going to go down to the ground and touch, and then you're going to slide them away until your knees are straight, and then bring it back up. Beautiful. So we do 5 of those. Let's just do one more for good measure. This one's pretty difficult, and if you have any issues with hip flexibility, you might not be able to straighten all the way out without your back arching. Are you gonna help? But the key with this, if you are struggling, is just keeping it nice and slow and controlled. Don't strain and hold your breath trying to focus on this. And not looks really good. So if you can get to 5 of those while keeping good form, then we're going to get to our last one, which I still struggle with quite a bit. Are you ready for it? So we're going to do that same move again, except this time the heels are not going to touch. So about 6 to 12 inches is high enough. You don't need to get too close to the ground. That's only a few inches, so you can get closer if that's too hard. But he did good with that. So to pass the test, you want your legs to hover around 6 to 12 inches. But as far as an exercise goes, if this is too hard, you can always modify and start way up here. This is about as high where I do this exercise at. And that's okay. You just want to figure out where you can do this exercise without arching your back, without your abs pooching or anything like that. Beautiful. So that is a great starting tool for assessing your core strength. While we're only technically looking at your abdominals, it's a great way to kind of assess your ability to control the movement in your pelvis and in your spine. And when we have a good solid base for coordinating that, then the rest of our core strength comes a little easier. And we will be covering a little more with the core when we cover the lower body, because that's when I'm going to cover glute strength. And we'll cover a little more with the upper body when we cover upper body strength next week. So there's plenty of things to work on with that. And the biggest key with that is no matter how strong you can make your abs laying down in your core with an exercise program, if it doesn't carry over into your daily activities, it's really kind of pointless, to be honest, because those are the motions that we're doing all day that are going to put strain on our back and on our bodies. So once you have a feel for good core stability, I want you to think about how you can carry that over to other activities, like when you're lifting objects or you're reaching for stuff or you're cooking or you're getting in and out of a car, or all those things that we don't usually think of as activities that put a lot of strain on our core. But those are usually the ones that get us. Those are usually the things that we have to work on once there is a problem. And those are exactly the things as a physical therapist that I end up having to help retrain people to do correctly. So if you can stay ahead of the curve, or if you're already experiencing pain, you should have a really good idea now of where you can start with a core strengthening program. So if you have any questions at all about that, just leave a comment below. I really hope that was helpful for you. That strength assessment is honestly one of the most common things that I review with people in physical therapy appointments at their first visit. And it's kind of eye-opening. I know it was eye-opening for me the first time I did it, like, whoa, why is my core so weak? And it's a great place to kind of know where you're starting and to build some awareness for the way you're using your muscles, and then you can build from there.